Hi, I'm Brandy Burkhart. I'm the lab manager in the simulation lab at the JMU School of Nursing. And I think that simulation is very important for the learners because it takes what they learn in the classroom and it makes them apply their knowledge in a clinical setting, but the clinical setting is in the lab, so it's a safe environment. If they make a mistake, they're not going to harm a patient as if they were in the hospital. So it gives them the safety of the learning environment to learn and apply their skills. Welcome to the James Madison University School of Nursing Simulation Program. There is over 7,000 square feet of lab space dedicated to skills acquisition and health assessment. The space is made up of a 6-bed high-fidelity simulation lab, a 20-bed skills lab, a 4-bed standardized patient lab, a health assessment lab, and a home environment lab. There are 3 debriefing rooms which are parallel to the 6 high-fidelity labs. The scenarios in the labs range from medical surgical, mental health, diversity awareness, health assessment, critical care, women's health, home health, and pediatrics. Students in all semesters of the undergraduate BSN program experience high-fidelity simulation, as well as nurse practitioner students in the graduate program. The goal of this video is to provide you with an understanding of the simulation environment and process. Research has shown that simulated-based experiences can produce excellent student outcomes. Simulation allows the learner to participate in an environment that mimics a real-life situation where decisions are made and interventions are implemented in the safety of the simulation lab. Simulation also gives the learner the opportunity to be exposed to specific situations based on their learning needs. A fiction contract is an agreement between the learner and the facilitators acknowledging the capabilities and limitations of the simulated environment. Simulated rooms are set up to replicate a hospital, clinic, or home setting. Although you'll find it is a simulated environment, you will be met with challenges just as you would in real-life clinical situations. Fidelity is the amount of realism that is present. The high-fidelity mannequins are meant to mimic a real patient, therefore they have heart sounds, lung sounds, bowel sounds, and pulses, as well as other actions that mimic a real person. We do our best to make the simulated environment like a real clinical environment, but we understand that we can't get there 100%. So we ask you to meet us halfway and do your best to treat the simulated environment like a real clinical setting. A basic assumption is a statement applied to all simulation-based experiences that allows the participant to understand the expectations in the learning process. In the JMU School of Nursing, we make the basic assumption that all participants are well prepared and ready to learn to improve their clinical practice. We commit to mutual respect and assume that learners are enlightened, caring, and willing to engage in self-discovery within the safety of our simulated environments. Simulation-based experiences are conducted in the safety of the lab environments. It is not meant to be deceiving and there are no tricks. The space and experiences are meant for learning, and any feedback you receive is meant to be constructive to help you improve your future clinical performance. The experiences are confidential. For the safety of all participants, what happens during the simulation and debriefing is confidential and is not to be shared with others outside of the simulation experience. We expect learners to do their best to treat the simulated environment like a real clinical environment and perform their actions as they would in a real situation. We understand there are limitations. However, we expect that participants recognize the limitations while continuing to treat the environment like a real clinical experience. We expect the participant to practice in the role they are assigned. At the beginning of the simulation, they will be given background information, generally in the form of a handover report from a nurse. We want the participant to use their knowledge to make decisions, utilize their clinical reasoning and critical thinking skills. We use standardized patients, participants, and embedded participants. Actors may be playing the role of the patient, family member, friend, or caregiver. They give special training to become part of the simulation, enhancing the realism of the scenario. There are also embedded participants, which could include interprofessional team members such as providers or pharmacy that you will communicate with on the phone, in person, or on video. The control area is where the behind-the-scenes action takes place during the simulation. It is on the other side of the two-way mirrors in each room. A simulationist, faculty, or operator is in the control area during the simulation, controlling the mannequin and the responses. The operator can also be the voice of the mannequin during the simulation. There are 2 cameras in the room that live stream and/or record the simulation to the debriefing room and the control area during the sim. Pre-briefing is the time before the simulation when the learners are prepped for the scenario. The facilitator reviews the logistics, expectations, and objectives of the simulation, as well as the environment. Debriefing is the period of time following a simulation-based experience where students reflect on their performance. Using a structured model for debriefing, students are engaged in the active learning process in order to increase clinical reasoning skills that will result in optimal patient outcomes. The importance of debriefing cannot be understated, as it has been demonstrated through research that debriefing is the most important phase during a simulation-based experience, allowing the learner to bring the simulation-based experience full circle.